Okay, so now we have we just went through how to put in our settings, and so once you get back to my treatment, it gives you the verification that you did that you are doing for the night, and you're going to hit OK. It says to hit OK, you hit OK. The machine will go through a little bit of a setup, and you'll notice that there is a green bar. So whenever there's a green bar, that means the machine is doing its thing. Alright, so after it goes through this setup, it should tell you to gather all your supplies and insert your cassette. If you notice, there's like you want to pull it out, there's two sides. There's a plastic side and kind of a film. The film will go up against it once it tells me to open up the drawer. At this point now it's telling me to open up the door, which is a little button right here that pops it open, it comes out, and to insert the cassette. There's these two little knobs here at the corner. You take and you'll see they'll go right here. So you'll take your cassette, go a little bit below it, pull it up, and then you'll need to clip that into there, and you'll hear the little click. Now you're ready to close it. Alright, after you get your first cassette in, it does a little bit of a setup, and there's a couple things you can do before the machine tells you, and one of those is connecting your drainage bags. So yellow, and on your here is also yellow, so you'll pull that off. You take this apart, take this off, and then screw right in, and now you've got it connected. What's important about the drainage bags is that there's two sides. There's an opaque side and a shiny side. The shiny side goes up, and then spread them out. And as you can see, I have the white chuck pad down so that we don't have it sitting right on the floor. To do the solution bag, there's 5 things that we need to look at when we open up the bags. And there is an acronym known as SCALE, S-C-A-L-E. S is solution, so your order will tell you what solution your doctor wants to give. Our order right now is for 4.25% dextrose, so that's correct. C is for clarity, so you should be able to see through the bag. A is amount. Our bags have 5,000 mils. L is for leaks. You kind of squeeze it, just make sure there's no leaks. And then E is for expiration date. And then as long as that all goes okay, then you're ready to put it on top of the heater. The first one goes on the heater. For our demonstration, we're only using one bag, so I will only use one tube. What's always remember, and I've kind of passed this along, it goes in order right to left. Yellow is for the drainage bag. The very next one is red. Red is for heater. Red is hot, heater. You just clip it in like that. And then if you had any other bags, then you will have additional tubes that you can attach to any of your other bags. The green one here is for if they have like a special medication that needs to go in at the end, then you would use that. Then you can also take your patient lines, this is the patient line, and put it into our organizer. So every machine we have has an organizer on it. It goes with the machine. It doesn't go per patient, it goes with the machine. We have a little blue thing, it goes in here, clips in there, and goes like that. And that will help when we hook the patient up later. So now we've got our fluid and we've got our bags connected, and so they're ready to hit next, sting everything again.
review the acronym that Sasha mentioned, SCALE. SCALE is an acronym to help you remember how to evaluate the bags of fluid prior to connecting it to the machine and then the patient. So SCALE, S-C-A-L-E, solution, clarity, amount, leaks, and expiration date. Solution, you want to make sure you have the correct solution that's ordered. Clarity, just like how we evaluate many other types of fluids or medications, you want to make sure it's clear and it's not cloudy or discolored. Amount, you have the correct amount for the total volume that you need for the procedure. Leaks, those are real big bags. They're big, heavy bags. So you want to make sure that it doesn't have a little hole in it or it's not leaking fluid. And then check the expiration date.
When setting up your organizer for the night, it's always important to put on a new cap. This will be the cap that they put on in the morning when they take them off, but it's always a good idea to have it in. This is what this Stay Safe cap, and it goes right in like this here, and it just sits there until they unhook them in the morning. Okay, so it just finished another little setup on its own. Now it's telling me that I need to break the cones and then clamp the unused lines. So on our bags, in order for the fluid to come out, there's a little red cone that has to break. Pops just like that. And then so it's out of there, you kind of have to hit the bag. This is why sometimes when I set this up, I will do it during that 6 minute because it takes a little bit to get those cones out, and you can do that while it's doing that 6 minute setup. You don't have to wait until the machine tells you. But you should see, you can see right there that that cone is now inside the bag, and that's where you want it. Then I need to clamp all the lines that are not attached to anything. So that's, and for our patient today is 4. So I'm going to go through and I'm going to clamp all these. This is the only time you need to worry about clamping with PD, is when the machine tells you to clamp it. That's ready. I've done all that, so now I'm ready for next. Now it's going to go through and it's going to evaluate what bags are hooked up. This screen is verifying what is connected. It has gone through and tested and made sure what is connected. So as you notice, this one, so the heater bag, is closed. So it's showing that it's connected. And the rest are open, which is meaning that they're not connected. So that is what we did. So I'm going to go ahead and hit next because I'm going to confirm that. Now it's ready to prime, so it wants to make sure that I have the blue clamp, which is the clamp for the patient line, open. And as I did not clamp it, it is open, but it wants me to verify. And so I did, and so I'm now going to hit next. And now it will begin to prime, and you will see it go up into the patient's line here in about a minute. So now it has primed, and you can kind of see, I'm not sure if we can get you low enough, but you can see that there is fluid here, so that means it's all the way where it needs to be. The machine is asking me to clamp it, or if I felt like it needs to prime again, to do that. But since the fluid's here, we don't need to prime, so now we're ready to clamp. And then we're ready to hit next. It will go through a couple questions. It's going to ask if there was a daytime exchange. Most of our patients, the answer is no, but if for some reason they had a yes, you would just click on it just like we did when we changed the settings to make it orange, and you would just say up for yes, but we're going to say no. So then it changes and that says there's no manual fill volume. So we're going to hit OK, accept that, and hit next. It wants to verify that what we said is true, and you're going to say yes. You can hit back at this point and change it, or you can hit next to confirm. All right, so now we're ready. This is ready to connect to the patient. However, this is just set up. The bag is not warm. We know that for PD, the fluid needs to be warm before it goes into the patient for two different reasons. One, if it's not body temperature, they can have a lot of abdominal cramping. And two, if it isn't warm enough, then it's not going to be as effective. So we set it up, and we're going to wait a couple hours before we hook up.
Sasha mentioned that now we're going to wait a couple of hours. The videos that you just watched go over all of the steps that you'll go through to prepare your patient for peritoneal dialysis. It's important that you focus on the word prepare because there's a significant amount of steps and time that you need to complete in order to get prepared to put your patient on PD. And at this point, as Sasha said, you'll wait a couple of hours for that fluid on top of the cycler to warm. This is important because you need to have some good planning ahead of time in order to make sure that your patient actually gets put on treatment at the correct time in the evening. They do this overnight while they sleep, so it's not something that you can start 20 minutes before you expect to be putting them on treatment. You have to start this a couple of hours in advance, give it time to warm, and then come back and connect to the patient. So the steps that we've just watched are all the steps that you need to go through just to get them ready. The next videos that we're going to watch include videos for the PD dressing change. The dressing change is very important. It is a sterile dressing change, and much like any other type of sterile dressing change you would do for a central line or anything like that, your technique is really needs to be precise. These patients are at high risk for infection, so ensuring that you have excellent sterile technique when you're changing this dressing will help ensure for your patient that they are not going to get an infection in their line, which could really impact their ability to continue with PD as far as a treatment regimen.